Good afternoon and welcome to this IHE-Europe March webinar. It's a special webinar because we welcome you on International Women's Day. So congratulations to all women in our webinar here. We do realize that we have male speakers today, but looks can be deceiving, can't they? So on this special day, we take the occasion to present to you the two women behind the scenes of the IHE-Europe Webinars series. The two women are Sofia Franconi and myself. We took the initiative and we drive the IHE-Europe Webinar series. So I will not be polite and I will present myself. I'm Carline Rauw. I'm based in Belgium. I work for a federation active in the technology industry, working for companies active in tech, which includes health tech. Since 2016, we have established IHE Belgium, and there we bring together the people who look into interoperability. In March 2020, we also established HL7 Belgium in the same group because we want to, we have both the same missions, interoperability, and therefore I'm looking closely to IHE Europe as well. I'm active within the Marcom committee of IHE Europe since more than 5 years and working together with people like Sofia. Sofia, can you present yourself as well?
Yes, thank you, Carline. So I'm Sofia Franconi. I'm interoperability solution architect with IHE Europe. So my main job is to work on the European projects that will be presented to you today. But I also do another part of the job, which is with IHE Europe, with the marketing committee like Carline, and also with the coordination of events for the Connectathon Week. So today we are going to have 3 speakers. Yes, thank you. On the key insight and industries opportunities on the European project related to the electronic health record exchange format. So we have 2 speakers that will present the XpanDH project. So we have Henrique Martins, who is the coordinator of the project, and Alexander Berler, who is healthcare interoperability and digital health expert at Gnomon Informatics, and also strategic business developer director at IHE Catalyst. And on the second part of the webinar, we'll have Robert Stegwee, who is CNTC 251 chair and lead of the Work Package 2 in the xShare project. So they will explain better than I will do the 2 projects. So I will leave the floor to Henrique for his presentation. Thank you, Henrique.
Thank you very much, and thank you for the kind introduction. If everyone's okay, I will be sharing my screen. I've prepared some slides, but of course available for discussion now or offline through the websites and things we have prepared for Xpand. Let me just make sure, find a good way to put this to work. Second. Just a small confirmation if you can see my screen.
If you can just put it in presentation mode, great, and then everything is perfect.
Yeah,
great.
So I have about 15-13 minutes. I don't want to steal too much time. First of all, let me give you the context. And I guess most of you are familiar with the context, but it's still important to remind ourselves that we are living exciting times. Possibly March, May, April, we don't know. We were planning for April or May to have good news on the approval of this important and groundbreaking regulation. And why is it important for us today in this context of IHE, electronic health records? I know we have company people, we have procurer people, people on hospitals, people on healthcare facilities, people that produce the technology. Is that this regulation is no longer just about cross-border exchange of health data or regulating secondary use of data, as most people became familiar with. It also includes going in depth into the world of primary use of health data and indeed electronic health records. And I'll go there in a second. But just a quick reminder of the definition of this European health data space, and it calls our attention to common standards and practices, infrastructures and governance framework. So I would say that this particular webinar is a practice, is an important practice around standards and other practices like testing and conformance that are still new in some contexts in the European e-health market. The overall vision for the EU data strategy is to build these data spaces, the first of which is health, but also connecting them through and cross-sectorial personal health data spaces and personal data spaces, which means that we are talking about high advanced interoperability standards, some of which have not yet been written. They do not exist as such. Some, of course, exist and have existed for many years, but have not been widely adopted or not formally legally endorsed. And sometimes we know that that was the only thing that was missing. So if you've never read the proposal, it's still a good time to read, because of course it will change with the negotiation between European Parliament and the Council of the European Union. But I don't think it will change dramatically in terms of structure, and definitely regarding the European electronic health record exchange format, it is strong in Article 5 and 6. This is where it is described, it is characterized, but it's important to keep in mind that Article 12, when we talk about the cross-border exchange, is to be happening under the exchange format. So it means that as we think about more and more data crossing countries, crossing regions across Europe, and even beyond, we are talking about also the usage of the format. Finally, common specifications, and of course, the aspects regarding implementation. And how is this format to be implemented? Well, it is to be implemented by decision, Article 5, number 2. The Commission, and I'm quoting, is empowered to adopt delegated acts to amend the list of priority categories, so it can add new categories, it can add things to the format of electronic health data in paragraph 1. Such delegated acts may also amend Annex 1, adding, modifying, or removing main characteristics. So first idea I want to convey is that the exchange format is a process. It is a dynamic process. It is not an end product. It is not something that, oh, I have the format, I'm compliant with the format. Well, what version of the adoption of the delegated act are you conformant with? That is always the question one needs to ask. So, and this is not new. We know standards are evolving creatures that have their own life, and that's not a bad thing, because that's what keeps them relevant and capable of absorbing technological change. Now, Article 6 is more concrete. It says that the Commission shall, by means of implementing acts, which are rules of law, lay down the technical specifications. Now, the question you might ask yourself is, okay, so someone sitting in an office is going to mandate this technical specifications? Well, to some extent, yes, and it's good that finally someone takes the lead and makes these decisions about standards stable enough that the market will adopt them because it trusts that they will be followed by many people. Investors will invest because they trust it's going to be relevant. And end users will trust the products because they know these standards are to be used because they have been mandated by law. Now, the lawmaker does not know digital health necessarily, or at least it could benefit from listening to experts. And this is where projects like XeHealth, XpanDH, xShare, and this is where I want to immediately extend my invitation. I know there are companies here and others, hospitals, other healthcare providers. There's a new call in town, and if everyone's very interested, please reach out to me because I'm planning to go for this. And why am I talking about the calls and about these projects? Because we have had old ideas from the first pilots called EPSOs, patient summary, and e-prescription. These are now established services that use and are used for exchanging data. They are now included in the format. So when people ask me, oh, so patient summary is part of the exchange format? Yes. And electronic prescriptions as well. So it's a sort of evolution in the sense that the standards are the same. They will possibly evolve, but they now are together in a group of aspects of data information categories. So what is the role of XpanD in this context? So XpanD is a short-term 2-year coordination and support action that aims to help mature the ecosystem and also mature the specifications to a level that they can be offered to the legislator, in this case, a joint effort between European Commission and member states, and make them become these implementing acts. So XpanDH is not writing the implementing acts, but it is contributing to looking at existing guidelines that have been approved over the years into these 5 domains: patient summary, e-prescription, e-dispensation, laboratory reports, imaging reports, and hospital discharge reports, and test them against what we call feasibility. So using some of our partners in what we call the X bubbles, we are doing not piloting, but a sort of pre-piloting. So looking at specifications, checking if they could be applicable in that context, or if there's anything missing, and then reporting back on what's missing. Now, with work package 2 and 3, we are also looking at maturing and stabilizing some standards and technical artifacts. And then in work package 3, that is led by IHE, we are looking at organizational readiness. How are vendors, IT producers, and hospitals and other healthcare organizations capable or not? How can they see themselves against this format and its requirements? So it talks about this readiness model that we believe will be a useful tool for everyone to assess their maturity against this upcoming challenge, which is to be conformant with EU-level regulation. I would like to always emphasize this concept that this is not a small thing. This is not a directive. This is not a small national law. This is an EU regulation, which means that it goes into legal force in all EU countries, regardless of national parliament transposition. So this means that the communities in the countries also need to be aware of this, and this is where Work Package 5 and Work Package 6 work together. I know Alexander will talk a little bit more about the XNets and especially about the community of doers and co-creators, so I will jump that part. Just to let you know, and to close very soon, that we then work on these adoption domains. So adoption domain is a set of partners, actors using the specifications of the exchange format to meaningfully exchange healthcare information between themselves. Okay, and when you ask, oh, so what's the difference between a lab report and an adoption domain? Is that you can use the same specification on lab reports to communicate labs to the app that the patient uses, or to communicate labs between a local laboratory software system and a national laboratory software system for the purposes of public health reporting. So these are completely different usages. These adoption domains are different. The data priority categories is the same in this case. So very quickly, as I explained, the X bubbles bring together these early adopters, organizations that look at these guidelines and specification, they choose a domain and they test for feasibility, and they act as demonstration sites. So different levels. I'm not going to go into too much detail, but depending on the type of challenge and the maturity of the specifications, we are also looking, for example, since last week, we started talking with pediatric people in the area of pediatrics, and we said, okay, well, what if this format also is useful for pediatrics? So there's other ways of looking at feasibility outside the technical domain. So this is our methodology. So we basically select the adoption domain, look at the feasibility within a scenario, and then review and verify against the e-health network guidelines, and then eventually list and identify needs, inform policy through what? Through the contribution of our project, which is a modest project, to the joint action XT-EHR, which is, as the name implies, a joint action between member state organizations, government, ministries of health, and the Commission to contribute to better guidelines and draft implementation acts. Of course, how does this all align? The readiness model will allow partners to know if they're ready or not. They identify needs, they feedback to improve the readiness model. So this is the work ongoing. This is a slide just to show you our partners. In Portugal, we're doing 2 types of bubbling, digital report, discharge reports and labs. Hungary, we're working more on the labs. In Greece, on discharge reports, so different contexts. And between Slovakia and Hungary partners, we are looking at cross-border. This is the type of exercise we look. So this is, for example, from Hungary. You see, they're exchanging information using PDF, whatnot. So what could be the to-be, and what are the implications of putting a new way, a new format of exchange, in this case, European exchange format. And then, of course, looking at these bubbles in terms of data fields and readiness. So this is a very detailed analysis that is being conducted by our teams in XpanD, and I'm very proud of that work that is ongoing. And I have to jump very quickly to let you know that we are also integrating the ecosystem. So creating the first network was Hospitals on Fire, but we have now evolved. We have an SDO industry board, which I would really like you to be engaged with. And if you're not, just ask Sophia. She is leading this effort. Of course, if you're from a hospital, Hospitals on Fire, if you're from a healthcare organization or any other partner, just let us know and we will link you to the relevant XNet. So an XNet is a group of stakeholders to whom we believe the exchange format may be relevant and they benefit from contributing. Community of doers, I saw that Alexander has already joined, so I will jump that. And let me please finish by acknowledging the opportunity to talk to you about this project, allowing you time to take a picture of the QR code, go to our website, follow us on social media. We will have a webinar in 2 weeks, so welcome there as well. And regarding the call, if you're thinking about applying to a EU project, it's not very good. It's 50-50. It's only 50% funded, but I'm very happy to discuss ideas with companies or healthcare providers willing to go for this co-creation of the exchange format. Thank you very much.
Thank you, Henrique. We will now give the floor to Alexander. And yes, the slides will be made available. The recording will also be available on the IHE-Europe YouTube channel. Alexander, you will have to unmute.
Thank you very much, Carleen. I think Henrique gave you the big picture. I will try to focus on a very specific task that we have just launched within XpanDH, which is what we call the community of doers and co-creators. So next slide, please. So what do we want to achieve here? We want to try to investigate a little bit more in detail how we could collaborate bottom up with the real people from the stakeholders to try to see where the exchange format could be of real use and try to create use cases and ideas that will come from the real people in need. And that's why we call it the 3C3P, meaning a community of co-creation that will encompass all patients, professionals, and programmers. So anything that you need normally to create an end-to-end use case. Next slide, please. So the idea of co-creation is not something new, especially in the software engineering. It's in the agile development. It's something that is widely used to try to create products that are oriented towards the real needs of whatever you want to solve. So the idea is to reuse this concept and try to create systems or solutions at the end that could have a better chance to be adopted. And the idea here is to try to mature new things and new ideas where we can reuse the whole exchange format in some cases, but even if just one document or one domain of a document is useful, that also is part of what we're thinking of trying to investigate. Next slide. So co-creation is an iterative process. So the idea is to start from defining the very basic, try to understand and really define the business case, the use case. Then, of course, we will have to find a way to align it with the exchange format. So in that use case where documents from the exchange format can be used. Then as we go deeper and deeper, we are moving towards more technical points, like who is creating something, who is reading part of the documents, and try to create, in some cases, if we manage to achieve that, and propose something that can be tested and validated as a proof of concept, let's say. And then at the end of that, the idea is that we can reuse all the results of this process and try to bring them to the next step for implementation, or maybe for the next project or opportunity to see that this is going to be developed. Next slide. So the community goes with all the assets. So the idea is that this goes both ways. On one hand, we want to catch new ideas and fresh things that are really could help boost the use and the needs for the exchange format. But on the other hand, we have a series of, let's say, assets that we want to bring to the table. And also from our side, it will be a way of trying to educate all the newcomers within the community to try to reuse things that we have, like the specifications from the exchange format that is being, let's say, handled by another work package in our project. Some testing tools that also IHE will provide. And of course, some participants may bring their own software components in order to see how we can achieve something more clear as an end result. Next slide. So how can someone contribute? The process is totally open. As said, we want to target people from all the communities of patients or citizens even more widely, professionals, clinicians, and other end users, let's say, and programmers. And in the term programmers, it's a little bit old-fashioned, but it could be any, let's say, role in the programming part, meaning software engineer and information architect or something like that. Those can be organized either as individual or representing some entity, a patient association or a vendor or an academic institution, a research institute, etc. So the idea is to create these person-centered concepts that demonstrate the value of the exchange format at the end in practice. Next slide, please. So we had a very interesting conference in Athens, the Digital Health Week, where we experimented as XpanDH the first time, and we created a first experiment trying to prove that this concept worked. And we managed in 90 minutes to create a first use case. We had a lot of audience, local audience from Greece, of course. and we had the patient association that was there, the cancer patient association, plus university and some other vendors. So we already conceived the first idea, and already a small team coming from Greece has already been created. But we want this to expand this. This is why we have launched on the website an open call for anyone to participate and to register to our community. And we will create a webinar on April 22nd. So more or less, please use that link to register and document your interest as well. So it's quite easy to register. I have created here a QR code of the same link so that you can even use it directly if you want to connect. Our goal is to have at least a small community of 50 participants. So we already have about 20-25 from the Athens experiment, but we want to expand it more. Through that link, we already have some registrations. So I think we will have a good group of people that will join us, and then we will see on April 22nd what will be our plans until end of this year. The idea is that we try to split ourselves in specific teams, either at the national level or at the thematic level. We will see how this will play out based on who is going to participate. And the idea is to present all those results in the final XpanDH conference, the Exchange Format Summit. I think it will be in December in Lisbon. Henrique can confirm. Please try to promote this registration with all your possible means, and please try to reuse the hashtags that we are using so that it gets a wider audience. Next slide, please. So just to have some view of how things from this registration process is moving. So here you can see the different interests of the people that have already registered on which parts of the exchange format they are interested. So we clearly see a preference on patient summary, but other like discharge report seems and e-prescription seems to be of great interest as well. And some want to bring their own ideas. So let's see what those ideas will be. As use cases, obviously we already have one related to cancer patients that we will evolve, and feel free to talk to me if you want to join us in that one. But there are other like patient experience reporting, patient access reporting, EHR solutions, and even active aging in some cases. So feel free, even when you want to register, there is a box you can describe your own ideas and the way that you would like to contribute. So feel free to express yourself in as many details as you can. This will help us build the continuation of that community. Next slide. So our next, let's say, event where we will try to be as many of us also present there. But we'll see how we're going to solve travel issues there. But XpanDH will somehow contribute to the IHE Connectathon week, which is June 3 to 7, where a lot of things will happen there. We will try to support through IHE and HL7 to promote the existing specifications so that they can be tested by the vendors that will be there testing their own products at the Connectathon floor. But in addition to that, there is a parallel floor, which is an experimentation floor, which suits our purpose. And most probably we will have an XpanDH track, and all the teams that can find a way to be there, we can be part of what we call the IHE Plugathon event on the European Theater Space track, so related to the exchange format. And I think with that, I have completed my share, right? So I would like to thank you very much. And I think the floor is to Robert now, right?
Thank you, Alexander, indeed. Welcome, Robert.
Thank you. Hope you can hear me well.
Yes, we can.
Good. It's a pleasure to be here and present to you the xShare project. I'm chair of CEN-TC 251. Not everybody may know that organization, but it's the European Health Informatics Technical Committee within CEN, the counterpart of ISO, and we work together a lot with ISO on most of the specifications that we do. And I'll be presenting to you from the xShare perspective, where I'm lead of Work Package 2. Next slide, please. The XpanDH project was just presented, and we're building on what they're doing, and we're running in parallel for this year. And we're also linked to the other project that was mentioned, XpanDH, that is looking into the EHR specifications for the Article 23 that Henrique mentioned. So we launched our event at the Athens Digital Health Week. That was a great success. You see all three projects represented here at the table, and if you click on the next slide, the next picture will appear. Hopefully, yeah, there we are. And there was a much larger group, so one more click, and you'll see the team that was present there for the launch event. That's still missing quite a few people that are engaged in the project. It's a big one. So we have, no, please go ahead. We heard Henrique already talk about the high expectations that the community in Europe has of the European health data space and the format. The objective is really to improve access and control by natural persons over their personal electronic health data. And that's where xShare takes a bit of a different perspective on what is to be done. It looks at the GDPR and actually extend what EHDS is doing, extended beyond the rights on data portability in the GDPR. And actually, we want to make sure that both people and professionals are able to get access to and share relevant personal health data. So that's the high expectations. And the question, of course, is how are we going to make that happen? And that's on the next slide. The vision that we have is that everyone can share their health data in the format with a click of a button. So that's the xShare button that we're talking about. And we are also looking at an industry label. That's on the right-hand side. So we're really taking this from an industry-driven perspective. They are the ones who have to develop the systems and the software and to actually make this happen in support of the European health data space. And from a standards perspective, there's 6 global standards organizations, if I count the European one, SEN, together with ISO on that side as well. ISO has shown an interest to participate as well. So we support, with the standards that we have, we support the format through what we have called the EEHRxF Standards and Policy Hub. And that will support the notion and the ambitions of the European health data space. And it's also aligned with the Global Digital Health Partnership, which is very active across the globe and is currently chaired by the Dutch Ministry of Health. And they are a partner in the xShare project to make sure that the format is not only responsive to the EHDS and the regulation, but also to the needs of the Global Digital Health Partnership. So we're building the European EEHRxF Standards and Policy Hub, which will be a sustainable organization by design to actually make sure that beyond the duration of the project, there will be a group that continues to lead that process. As Henrique mentioned, EEHRxF is a process as much as it is a product with versions and requirements. So another thing that we're doing, that was on the last slide, is yes, thank you, is examine the feasibility of the industry label that I mentioned. I will come back to that later on. So why are we establishing this hub? If you look at the expectations and the notions around the format and the complexities that are there, we really want to make sure that the benefits are being realized. Standards-based innovation is really key to what the standards bodies are doing. And it's also a policy objective across the European Union. But the users just want to make sure that they have this button and they can share data. So if you are talking to users in the co-creation part and the community of doers, then that's where the hub will provide the expertise, the guidance on what is the EEHRxF, how is it relevant to them without having them to sort everything out themselves. And they also will take back any experiences from the users to improve and version the EEHRxF. The industry will, as I said, realize these systems in that are conformant with the EEHRxF, and we are directly engaging with the industry and make sure that their IDs are being met and also supported in and scaled, if you will, that it's not just one adoption site that thinks of something but we actually make sure that the industry knows about them. Regulators, I mentioned the Global Digital Health Partnership, which is a regulators or a ministerial group of countries. And we want to make sure that whatever we do with the EEHRxF in real life is aligned with what's going on in the regulatory part, and they need global standards to actually make sure that they can point to them and make sure that they are well enforced, if you will, through legislation. So the hub actually enables this whole standards-based digital health ecosystem. We're not running the show, we're just supporting the communities that are out there to co-create the health data economy across Europe. And if we go to the next slide, please. Then there's three modes of operations in the hub that we foresee. The main goal is to drive adoption on the business side. So business-driven implementation using the format, drive adoption of the format where it's already there, where it can be reused, and etc. At the same time, also driving the maturity and maintenance of those specifications also through global alignment and harmonization, not only at the regulatory level, also at the standards level. So that's part of the main mode of operation that we're looking at. But of course, there's new use cases coming along, and we want to make sure that if there's new requirements on the format, on the specifications, then those new use cases will give rise to development of those things. And those new specifications then need to be aligned again with the global standards, or the other way around. If they're really new, we want to have standards out there so that others across the globe can use that as well. And as Henrique already mentioned, it's a process with versions. So on the right-hand side, we also want to support whenever that's necessary to migrate to updated specifications and deliver those updated specifications based on the input and the experience that we're getting and the maturity as the maturity of the format actually grows. So that's the main use of the hub and the main focus of how, from an xShare perspective, the hub promotes the use of the EEHRxF and takes in the whole idea. The squibbly things that you see are all co-creation. So we're not saying, well, this is it, as Henrique was saying. Neither the standards people nor the governments know what's actually needed. So we need that co-creation mindset out there. Next slide, please. What do we offer? Access to the latest knowledge and expertise. Of course, a neutral place, and that's what SDOs are all about. It's a voluntary agreement among all parties concerned. So it's a neutral place supported by the global SDOs to actually do the alignment, development, and maintenance of the specifications at the aligned level. Of course, there will be versions nationally. There will be versions that are particular to the cross-SDO MyHealth@EU specifications, but that alignment of those different sets of specifications, we provide the neutral place to do that. And it's also a way to engage in the actual testing and assurance that will support any of the regulatory requirements, whether it's through the EHDS or the medical device regulation or other regulations. Of course, the AI Act is coming along, the Data Act, but also especially on a national level. So how do we do that? Just quickly, I won't go into the details in the next slide, but just to give you an overview of how we implement this idea of the business-driven implementation, where we have the community collaboration with the researchers, the entrepreneurs, the health workforce, and we're taking that business use case driven approach. So it's really about the use case locally at the adoption site, and then take it through a distinction in different types of components to the governance level, where together with industry and the regulators, we want to make sure that we actually have the whole of the format aligned and not just siloed solutions for the individual use cases. So that's our job, to make sure that that is aligned, and that the format supports as many use cases with as little extra requirements or siloed requirements in terms of either regulators or industry work. And this builds exactly on the vision of the XpanDH project. So if we click once, hopefully the XpanDH things will appear. So the X bubbles, the experimentation bubbles, is where we work together with the community. There's XNets on that community side, but there's also XNets on the industry and the regulator side, as was mentioned. And the key way to translate the format into usable specifications, support materials, and tools for the community, for the adoption sites, that's where the X bundles come in. So that's how we want to work. So next slide, please. How can industry help us establish the hub? Please engage in the industry forum, or already engage in the XNet that's there for SDOs and industry within XpanDH. Of course, we'll take it from there, and really share your experience and opinions of the EEHRxF. And if you're already working as industry on making sure that your products are fit for the EHDS age, and are already looking into how to do that, please share those experiences and your visions on that. And of course, at a local level, where you are co-creating, then please ask us to help out. There will be an open call for other projects, for other adoption sites to be engaged as well, outside the current scope of the xShare project. So there are ways to actually do that. Provide the tools and materials that you have and make them available to the community. So we are really taking that community of doers that Alexander talked about, taking that further and making it kind of a central place, or at least a central hub, to actually support those communities out there that want to work on the format. And it is for the industry, of course, an excellent way to showcase your solutions, how they work with the electronic health record exchange format, how they implement the xShare button, and how that works. Already, Henrique mentioned the call on the health record. I'd like to add another call, the health access call. How do we support patient access to their health data? That's another call that, especially from the xShare perspective, is an interesting and very good one. And please, if you can participate, please do. And we'll be monitoring and working together to actually make sure that we can provide the support from the hub as well. So next slide, please. The industry label is what we're working on in the next couple of months, and see how we look at the xShare industry label, related, of course, to the EEHRxF. We'll do some interviews and questionnaires. If you want to sign up to them, then please leave your name and number. And there will be workshops in May, in which we really want to look at what this label should be, how it should work together with other regulatory requirements on certification, how it best employs the IHE methodology and other methodologies, so that we can in June actually publish the vision on for an xShare industry label. under the motto of liberating health data, so that everyone has access to their health data and can share it with whomever they feel is necessary to actually better their health and healthcare. Thank you.
Thank you so much, Robert. We have a question on the hub. The security is very important because we want to protect private information about the patient. Is this subject also covered?
Yes, definitely. As I mentioned in one of my slides, it is about having not only access but having quality, reliability, privacy, and interoperability. And of course, interoperability starts with the whole notion of having secure connections there. So we do have the security and privacy people on board. It's also part of the Article 23, of course, that we need to have security and privacy included. So yes, it's definitely part of the specifications and definitely part of the hub.
I do have a question, Robert. This hub, it will not only be for testing purposes, but also once we go live, or do I misunderstand?
The whole idea is that we do keep on interacting with the people that are in live deployment to get their ideas and experience back into the standards development process. That's one of the things that the SDOs working together have also advocated for already in the standards project, that we really close the loop and not just put out specifications and depend on individuals to bring back experiences, but really have the closed loop through live deployment and through the fora and the communities to actually get the new the requests for changes, new ideas of doing things, and also incorporating new types of standards, which will definitely come along at some point in time, which is one of the reasons that we really want this to be an entity that is there. Well, forever is a bit much, maybe, but longer than the 2 years of XpanDH or the 3 years of xShare, but definitely as long as organizations like HL7, IHE, CENTI 251 are in existence. So it should really be a key playground, market, whatever you want to call it, a community with the health informatics standards people, but especially fed by the people that are using our standards and have a real life experience in what it means from a clinical point of view, from a patient point of view, from a research point of view, and also from a technical point of view. But we tend to focus just on the technical point of view and tend to forget about the actual end game is, of course, that we get better healthcare at lower cost in the end.
Yes, indeed. Very interesting, Robert. Does anyone have a question? Feel free to speak up. You can unmute yourself and ask your question or put it in the chat.
I might have a question. This is Jan from IHE-Europe.
Please do so, Jan.
I would like to ask, well, first of all, thank all three speakers. It was really, really insightful. And in the meantime, I had copied it to all of IHE Czech Republic because I did not see anyone. So I was angry with them that they did not participate, and their homework is to watch it from the recording. And we'll test them if they did so on our next IHE Czech meeting. But my question would be, you had mentioned a couple of times the validation and testing. Can we look a little bit more into that? What is ahead of us? Will it be more of a pyramid that will be testing on a lower level and then going up, or what is the general idea of this?
Alexander, you want to take it, or shall I start and you follow up?
Please start. And as the hub manager, and I will follow up.
Okay, thanks.
On what you said.
It is interesting to see how this will work. We don't know yet what the EHDS regulation will say, and there's opposing views from the member states and from the European Parliament on what should be done in terms of validation, testing, and assessment. And we also have different categories of products to talk about that have different regimes under which they offer their services. So for that purpose, we've actually are very happy that we brought together not only IHE, which has extensive experience in testing, especially also in the My Health at EU part, but also DNV, Diagnostica Veritas, which is a notified body and is very well versed in the medical device regulation and all the testing and assurance that comes in there. What we're trying to do is make it as easy for industry as possible. And that's also where the vision on the industry label comes in. How much can the industry label already inform the regulatory authorities and the notified bodies and the official certification as requested by the EHDS? How much can already be done on a voluntary basis through an industry label, and how much of that will be recognized by the authorities to actually make that happen? And that needs to be developed over the upcoming year or two, depending on what the timelines are in the EHDS.
Yeah, I'm trying to complement what Robert said. So the work of xShare is of extreme importance to try to streamline this for the industry. But I think also for not only for the industry, but also for the user side, so that they can say their voice somehow, so that it can be heard and brought into the X bundles. Now, concerning testing, IHE will have, at least in the next event in June, 2 testing floors, one which is more formal for IHE profiles, but also one experimental testing floor. So the first one, we will try to bring as many, let's say, content profiles as possible for the vendors to test, especially IPS. Patient summary, we already have a lot of vendors that are experimenting on that. But on the plugathon floor, we are free to reuse the knowledge of the 2 projects to try to create experience for the industry to start experimenting and testing at the initial level of testing. And this will help us greatly to propose something, probably through the industry label, or I don't know what else will come up, so that we ensure that it can be easily adopted by the vendors and the industry. That's, I think, is one of the prime goals of both projects, I would say.
Michael, you are asking if the workshops in May will be in person or online. The plugathons will be in Trieste in Italy.
Carleen, I think for the plugathon, there is another, I think you have a slide for that. There is a town hall about that.
But Michael was referring to May workshops, and I'm not sure if I understand his question correct. Do we have any May workshops as well? The plugathon workshops, the slide is here.
Robert was explaining industry workshops.
Yeah. If it's about the industry workshops, then I'm afraid I'll have to. I won't be able to answer your question. I don't have an indication whether it will be in person or online. Of course, the questionnaires will be online. I haven't heard from the organizers whether it's meant to be in person or online or hybrid. Of course, it depends on, of course, also on what type of workshop we want to have. Where some of those workshops really might need face-to-face interaction because, of course, online is great, but there are limitations.
Yeah, and I think the Plagathon part in Trieste there will be a flavor for online participants. More information next Friday.
But we do encourage you to come in person because there will be educational tracks being part of the Plagathons. So it's definitely worthwhile to join these in person. Henrique, you raise your hand. Please speak up.
Yeah, I just wanted to add to my previous speakers and sort of invite everyone to be proactive. I think, of course, those of you that are in this webinar, it's because you are proactive. but definitely, I think now is a chance to. We are in a phase where those that move now will have a first mover's advantage, and I think it's difficult to see that, and it's difficult to believe that will be the case because, of course, it is a big investment. In many IT products we have today in the market and in the ground, these specifications are a challenge. And the problem is that they're not perfect and they're not finished. So the other thing people often ask us is, oh, okay, but so when you have it finished, let us know. What is the final one that we should follow? And that's taking the wrong stance at this. So it's actually creating a sort of a European format team or behavior or culture within your companies and providers that is the necessary next step. That is capable of following and absorbing what's happening, but also participating and influencing. And I wanted to leave this idea very clear. So there isn't a set of people that will prepare some sort of document that will then become the truth and everyone will follow. And if you don't follow, you have a fine. I don't think that's going to be the case. And to conclude, this is no different from the GDPR. So when GDPR started to being discussed, there was a lot of uncertainty and a lot of people were waiting and waiting and waiting. Those that did not wait and prepared according to the principles of the regulation and the logic of the regulation, they prepare their organizations for being privacy compliant, even before the detailed demands and specifications from their national data protection agencies starting to come into their business life. So they were ready. Others were not. And suddenly, in 2 years, the regulation came out in 2016, and then in 18, they were all stressed out because the deadline was over. So this is what I would like to leave this idea, very, very simple idea. Getting ready for the format does not mean a passive readiness, and also being prepared does not mean that you will be prepared forever. So this is what, and I think now there's a lot of spaces for engagement, a lot of opportunities for engagement, and really this opportunity also to talk about that is good. Thank you so much.
Thank you, Henrique. We have a final question because we like to finish on time because people have other meetings ongoing. But the final question is, how can people from other countries outside the EU play an active role and contribute in this initiative? It might be a negative answer. I don't know.
No, I think, I mean, at least from XpanDH perspective, we have already organized a meeting where we had colleagues from Canada, colleagues from Singapore chipping in and discussing online and face-to-face. Some of them were actually happened to be in Lisbon. So definitely we are opening these discussions. And I know also that in xShare, but Robert can complement, we have expected activities at the global scale to talk about, but also to start understanding the format as a EU-born global reaching initiative. So I think definitely. So I think for now, keeping up to speed with the webinars and things, these are open. These are not close to the EU IPs, but there will be, I presume, more concrete workshops and discussions. I mean, I for myself have been writing and talking about a global electronic health record as a sort of a conglomerate effort that possibly will need different actors, and IHE has also been active. For example, in Dubai, we were there. I had the pleasure to also be in an IHE sponsored event in the Dubai conference. So I think we are open and we want to discuss this more broadly. We do not want a European the word European exchange format and just keeping the format word, because also it's more than exchange. It's also a community.
And can people get in touch with you, Henrique?
Oh, definitely, yeah, of course.
And same here. As I mentioned, the Global Digital Health Partnership is very much engaged with this, and the IPS, the International Patient Summary, is of course the poster child of what we try to achieve, because it started with the European Patient Summary. Then through transatlantic cooperation, it was brought to the international, to the global world, and now everybody is talking about the IPS, in particular the Global Digital Health Partnership. So that's kind of the vision that we're striving for through the hub and through these projects.
Very interesting. Thank you very much, Robert, Alexander, and Henrique. And please, to everyone, talk about it and encourage people to rewatch the recording and get in touch with all of the projects and respond to the calls. Thank you so much. Have a great afternoon, and we'll meet again.
Thank you very much.
Thanks.
Thank you.
Thank you.
Bye-bye.
Bye.